And new this morning, lawmakers have been very clear since the coronavirus emergency started. People should not have to pay to be tested for COVID-19.
Yeah, it is written into new federal law in the emergency order in Arizona. So as 3 on your side, Susan Campbell found out, some patients, though, are still being charged at their appointments. Susan.
Yeah, in one case, it was a $50 copay. The man who paid it said he could afford to pay it, but he knows other people may not be able to do the same.
It's kind of scary, but
Brian Halleck had a bad cough and a fever that wouldn't go away. He went to his primary care doctor who told him to get tested for COVID-19.
I knew I had to go through Banner. So I called the hotline and they said to go to the urgent cares. And I get there and I told the lady when she checked me in, she's like, there's going to be a copay. And I was like, well, I thought they weren't supposed to have a copay for it.
Here's why Brian says he was surprised. According to the federal government's official summary of the Family's First Coronavirus Response Act, the law requires private health insurance to cover testing for COVID-19 without imposing cost sharing. It says this coverage includes the cost of administering such approved tests and related visits to healthcare providers.
And she's like, no, you got to have your copay is $50 for the urgent care.
He paid it, then contacted 3 on your side.
There's a lot of people that aren't going to be able to have the means to pay for that testing if it comes down to it.
Turns out if Brian had been able to get an appointment at Banner's drive-through testing site, he wouldn't have been charged at all. A spokesperson for Banner Health said there's no copay there or for the actual test. But she told us patients may be responsible for a copay if they get the test done in an ER or urgent care facility because, quote, a provider will evaluate them and other tests or services may be performed.
It sounds like somebody may owe this guy $50.
Karen Politz is a senior fellow at the Kaiser Family Foundation, a nonprofit focused on health policy. Politz says the only reason someone should be charged while getting a COVID-19 test is if they were treated for something unrelated at the same appointment. For example, a sprained ankle.
For the COVID-19 test itself, there isn't supposed to be any cost sharing. The concern is, that someone will be in line for a test and be asked for $50, and because they don't have it, they'll get out of line and they won't get the test. So, they're making it free is not only a patient protection, but important to the public health.
Banner Health told 3 on your side if the patient's insurance company processes the claim and a refund is due to the patient, then we will certainly process that refund.
We got some good news from Brian. He says his test came back negative. He says he's already feeling much better and back to work, guys.
All right, Susan. Well, we appreciate the information. There was such a shortage of tests to begin with, so hopefully people have no problem getting that. And then when they get there, they don't have to pay for it. So,
Susan, have you been getting a lot of questions coming to you as a consumer reporter? And, outside of the testing, what are the other questions that people are having right now?
Yeah, there are a lot of questions with the testing. There are some concerns that when people call different hotlines to try to schedule these tests, that the appointments are already full for the day. So they're having to wait a day or 2 or 3 to actually just go and get the testing done. So that's been a frustration for consumers. And so something we're obviously staying on top of. We also had chatted with Senator Sinema's office about this particular issue. They said it's clear more needs to be done to make sure these tests are accessible and free, like they're supposed to be for anyone who needs one.
All right. Susan, thank you for that.